There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, why does low blood pressure is more harmful than high blood pressure? Defining terminology. High blood pressure or essential hypertension is blood pressure in the brachial artery, the artery in the upper arm, equal to or greater than 140/90ths of a millimeter Hg after a period of rest, preferably in the sitting position without prior smoking. All these criteria are apparently too many to handle. However, they are important as large clinical trials and recommendations based upon them are based on these parameters. Low blood pressure, hypotension, in itself is not a disease. If it is associated with a high pulse rate, cold clammy extremities, low urine output, then it is called peripheral circulatory failure, or more popularly known as shock. This is a dreaded manifestation of disease and needs urgent intervention, without which the person may die. Shock is rarely found outside hospital settings. More common is postural hypotension, which in turn may be a manifestation of antihypertensives, aging, autonomic neuropathy, a disease of peripheral nerves, or other disease conditions. This basically means that blood pressure falls when the person sits or stands up, making her dizzy. Even commoner is a low normal blood pressure, which laymen usually call low blood pressure. People who have blood pressure on the lower side of the normal distribution curve of the population often are diagnosed as having low blood pressure. Is low blood pressure harmful? Appropriately, this should be called low normal blood pressure, which is nothing but a variant of normal blood pressure. There is no reason or evidence that this is harmful. Neither does this require any treatment. In the treatment of hypertension, however, guidelines may vary on recommending the target blood pressure, or how much the blood pressure should be lowered. Some guidelines prefer intensive treatment and some do not. A word of caution here, this has nothing to do with the population that have a low normal blood pressure. Just to cut the crap. Most of the time low blood pressure is perfectly normal and is certainly not more harmful than high blood pressure. I hope that helps. If you need more answers and advice on hypertension, I've included some links in the description.